Hello, this is Tu Zhang with Clinical Medicine Class 2, ATSU. Today I'm going to talk about vaping-associated pulmonary injury with superimposed mycoplasma infection. This case is about a 26-year-old African-American female who presented to the ER after having about a month of shortness of breath, wheezing, chest pain, dyspnea on exertion. The symptoms got worse the past week or so, which brought her to the ER. Patient does have a history of schizoaffective disorder, previously treated with ziprasidone, but she denies history of any pulmonary issues. She denies smoking cigarettes, but she does vape occasional marijuana and tobacco products every now and then. Vital signs on presentation: patient did show tachypnea and tachycardia with a fever of 101. Patient's oxygen saturation was low at 84 on room air. It did improve up to 94 with 4 liters of O2. Patient underwent chest x-ray, which did show some bilateral opacities. She also underwent a CT scan to rule out pulmonary embolism, but also showed some ground glass opacities bilaterally as well. The patient's urine toxicology report was positive for THC. Her condition overall started to decline rapidly, so she was intubated and started on broad-spectrum antibiotics, vancomycin, zosyn, and azithromycin. Bronchoscopy along with bronchial alveolar lavage was performed on the patient, which showed predominant neutrophils as well as lipid-laden macrophages. Follow-up laboratory results show elevated levels of IgM for mycoplasma with a total titer of 1274. A normal level for this is 770. The patient also had elevated CRP at 32 and elevated LDH of 356. HIV influenza swab and Legionella urine antigen testing were all negative. Sputum and urine culture was negative as well. Broncholavage was negative for bacterial, fungal, and viral, as well as pneumocystis pneumonia staining. The patient did show an improvement in oxygen requirement and fever reduction over the hospital stay. She was extubated and discharged on day 10 and sent home on a total of 14 days worth of antibiotics total. Over the course of the stay, the patient did not get started on any corticosteroids because she'd shown clinical improvement on antibiotic use alone. The patient was seen on an outpatient basis about 3 weeks later and did admit to intermittent use of vaping again, THC and tobacco products. She was thoroughly counseled to quit at that time. So the discussion for this patient, she meets the CDC criteria for vaping-associated pulmonary injury, which requires 1, vaping for a minimum of 90 days, 2, the presence of pulmonary infiltrates either on CT scan or chest x-ray, both of which she had. 3, the patient had infection identified via culture or PCR, but the clinical team also believes infection is not the sole cause of the underlying lung injury. 4, no evidence on medical record of alternative plausible causes or diagnosis such as cardiac, rheumatologic, or neoplastic processes. Let's go back. The patient also had positive lipid-laden macrophages. She fits CDC criteria for vaping-associated pulmonary injury. Studies have shown that vaping has shown to be associated with an increase of lipid-laden macrophages. Mycoplasma infections in the lungs alone without vaping do not show lipid-laden macrophages. Additional studies show that people who vape also have an increased activating platelet factor receptor level lining the lungs there. When that is increased, pulmonary infections are more likely to occur because pneumococcal pneumonia easily bind to these receptors, and vaping makes the airways more vulnerable to these bacteria sticking to the airway. So this concludes my discussion of this case. If you guys have any questions, please feel free to comment.